Hello my friends, your family doctor, Dr. AP. Recently one 80-year-old female patient, old lady, she was admitted for pain in legs, pain in one leg, single leg, severe pain in one leg. She was admitted in the hospital. They had money, so they admitted her for pain in leg. She didn't get relief for one day. Second day also she did not get relief. They did lots of various investigations. After 2 days, the hospital is saying that we will do COVID test. At this point, the relative, the son of that lady, he said, I deny the test. I will not allow the COVID test to be done. And he took discharge from the hospital and took his mother at home. Brilliant. This is really brilliant. This should be done by everyone. Whatever is the symptom, treat the disease. Don't try to intervene COVID again and again. It's enough and it's the end now. Fortunately, I came here, Papa. Even government has told that if you don't have any symptoms of cough, cold and fever, yes, you can skip COVID test. Because a similar case, a patient had got heart attack. A young patient, he was admitted in the hospital. He got the primary treatment. Later on, he went to some government hospital. There they did COVID test. Unfortunately, and very unfortunately, he turned out to be positive. Now, instead of doing the treatment of angiography and angioplasty, he was sent in COVID ward. Ridiculous. Nonsense. This is nonsense. Poor people did not have an option. But he came back home safely, luckily. Actually, I am totally against this, whatever is going on. But the message is, if you do not have any symptoms, you can really say that I don't want to do COVID test, because the stress comes in the mind of the patient. Stress comes everywhere in the house. The full family is in panic. They become anxious, panic. Is it right? Is it really right? Now it's the ending. COVID is almost done, yaar. It's finished, full stop. Why are we again and again doing COVID test even at this time? When government itself is saying that only when it is necessary, then you do it. Few people will say, no, we should do it. Everyone will spread. You go and do the test. Who is saying, you yourself go and do the COVID test, you may turn out to be positive. You may turn out to be positive. Out of 10 people, if 10 people do without any symptoms, they don't have any symptoms, out of that 5 to 7 people may come positive. Asymptomatic patients are everywhere, man. Everyone is COVID. I have already told earlier. It's a simple virus now. Nothing serious. But don't try to stop the treatment, the primary treatment. Heart attack, it's a killer. Pain in legs, is it really related to COVID, the pain in legs? No fever? Old lady? You all are trying to harass the people now, at this moment now. Everything is done now. It's gone. Hence, the message is clear. If you think it is required, only then you do COVID test. Or else you can deny. It is your wish. Don't try to do COVID again and again, because really it is a panic. It is an anxious moment for the whole family. A very, very stressful moment for the whole family. Why to go into stress again and again? I got this courage to come in front of you to say this, because even the government says now that if you have symptoms, only then you do the test. So simple. Hence, my friends, the message is clear. If you want to do the COVID test, is it really required? First, think about it. Don't do it without use. Don't do it without any purpose. Because do the treatment. The treatment is important. The treatment of the disease, the treatment of the condition what the patient is suffering from, treat that. Don't try to intervene COVID again and again. Please, I am fed up of this now. I came clearly in front of you to pass on this message to the whole world, to the whole earth now. Stop this nonsense of COVID now. Please, treat the patients. That is more important. Treatment is important. This nonsense is not important. Till then, it's a goodbye from Dr. AP. Thank you very much. Namaskar.